In my daily life of helping dental practices and groups select, purchase, and implement dental electronic health records, it seems like, especially the last year, I've had a lot of questions around what is the EHR incentive program and how can I get the funds that are available to me from the government. Well, I've been involved with this program since its inception about 4 to 5 years ago, and it is a very confusing program. As most federal and state programs go, they do have quite a bit of hoops to jump through, a lot of rules and regulations, but there actually is a light at the end of the tunnel, and there are ways to get your money. So because of all the confusion surrounding this, I thought it was really a good time to sit down and put together an educational webinar, taking my experience and trying to help dentists and dental practices become eligible and obtain the funding which basically they deserve. Now, something that's always bothered me is that out of all the money given out of the last 4 years, a large percentage really has gone to the medical community, to physicians. And I think part of it is obviously because there hasn't been enough exposure of this program in the dental community. So hopefully after this webinar, dental practices will realize what they're leaving on the table and will be able to get those funds. So I thought it was important to go over a few topics this morning, and the first one really is to explain what this program is and where did it come from. Basically, as I mentioned, I've been involved with EHRs for about 12 years now with practices. And I remember sitting around with some federal committees I was on a few years ago, and we were trying to figure out how to get basically the goal 100% EHR adoption within our country in a few years. And went back and forth, and what the government determined was that, look, we'll be willing to put money into this. We'll be willing to put skin into the game. And what they came up with was a program where if practices acquired a certified technology, then the government would basically pay those practices to do this. So the way it worked, though, it was out of two federal programs. It was out of the Medicare program and the Medicaid program. Now, the Medicare program, as we all know, Medicare is not used that much in dentistry, so it's fairly irrelevant to dentistry per se and to dentists. But I think it's worthwhile in terms of, from a historical perspective, going into the Medicare part of the program. So basically, if you took Medicare, what you would be eligible for was up to $44,000 payment over a period of 5 years for acquiring and using certified electronic health record technology. Now, there's been, to this date, from 2011, there's been over $20 billion in provider payments. So this is a real program. This isn't just what people are talking about. It's real, and there's been money paid out. The important thing to understand is that on the Medicare-based program, which again is not that applicable to dentists, that program this past year ended. So at this point, what they're doing is they're actually docking Medicare money from practices. So if you are a dentist and you do take Medicare money, then technically if you do not have certified healthcare or certified electronic health record, each year they will take a percentage of Medicare away from you. So that's something that's important, obviously affects the medical community to a large extent. However, let's jump into a program which is a little bit more applicable to dentistry and to our community. And this is a program that's based on Medicaid and actually is doled out by the state programs. So each program is a little bit different. That's where a lot of the confusion comes in. The Medicaid program can get a little bit crazy. Let's say you're a group practice and you're in 3 or 4 or 5 states or more. Basically, you have to be concerned with the rules and regulations for each state because they are a little bit different. I'm working right now with some group practices that are in multiple states, and I have to individually go to each state and find out what their rules are to get money for those clinics in those states. So the Medicaid program can get a little bit crazy, but if you know the rules, that's really what it takes. So basically, the good news in the Medicaid program is that you can get up to $63,750 per dentist over a 6-year period. So for example, a 10-provider group would get a little over $637,000 during the period. And the great news is that whereas the Medicare program basically ended this year, the incentive money basically ended this year, we have the next few years to get the money. So basically, if you start the program by the latest 2016, next year, then you're still eligible to get the $63,750 from state Medicaid. Now, it's important to note that it does take time. I've been helping, as I mentioned, practices for years acquire EHR technology, and it just doesn't happen overnight. You have to look for it, you have to purchase it, you have to implement it, which takes a while. So the one thing to note is even though the last year of starting the program to get all your money is 2016, it's probably important for you to start looking now at certified electronic technology because it does take a while to implement and use. Now, the way this works is you can look at it in two phases. The first year, you need to show the government that you have acquired a certified technology, whether it's purchase orders or by other means or leases, you have acquired the technology. So that's the first year. Then the years following that, years 2 through 6, you have to jump through a lot more hoops because you actually have to show how you're using the technology. And that's really important. There's a lot of metrics that you need to report on. Things like how you're using electronic prescribing, problem list, how you educate your patients, are you interoperable? And I mentioned these rules change all the time. They're constantly in flux, so it's really important to keep up on those. But at the end of the day, the first year, you have to show that you've acquired a certified technology, and then the following years, you have to show how you've used it and report to the government on that use. So it can get fairly complicated. The second item is how do you determine if you're eligible? Well, there's a few criteria for this. Obviously, for the government to give you money, you have to be qualified and have to jump through some hoops. There's no free money in this world. There's no free lunches, as they say. So let's talk a little bit about the eligibility requirements for this. So you must be a dentist, number one. Secondly, you need to take, if you look at all your visits over a period of time, you need to have at least 30% or greater Medicaid visits. Now, if you're a pediatric dentist, it can drop down to 20%, but at the end of the day, you have to show that you have met this percentage of Medicaid visits in your practice. Now, if you're an FQHC, a federally qualified health center or community health center, they also take into consideration not necessarily just the percentage of Medicaid, but they look at, do you do sliding scales with your patients? Are there other methods of payment? They really want to encourage FQHCs and CHCs to be part of this program, so they have a little extra requirements that can help them attain the money. Then finally, though, the most important thing here is you must use a certified EHR. As I mentioned before, not every electronic health record is certified by the government. In fact, I've worked with a number of vendors over the years in certification, and there are a lot of hoops to jump through. It's very expensive, and I applaud vendors that do take the time and the funding it takes to actually become certified. So now in dentistry at this point in time, we don't have quite as many certified EHRs. I think that will change over time. If you look at the medical community, in order to stay in business basically these days, you have to have a certified electronic health record, but not the same in dentistry. It's just kind of coming to the fore. And again, I applaud any dental software vendor that has really gone through the expense and time and struggles of becoming certified. So what is a certified EHR? How do we look at, evaluate, select certified EHRs? Because if we're going to spend the money to get an electronic health record, we want to make sure that using that electronic health record, we are eligible for the money. Well, this is where a lot of confusion comes in. There's a lot of gaming of the system by vendors, and it's really important to understand what's going on. I've actually written a lot of articles about this. I wrote one for Dental Products Report about the smoke and mirrors approach that vendors are taking. I did a podcast about how some software vendors are taking a cheap and easy route to EHR certification. So I want to go into this a lot. I get a lot of calls by practices that say, hey, a vendor has approached me and told me that I can get this money from the federal government. Well, I'll tell you that probably in a lot of cases, the salesperson didn't even really understand what it takes to get the money from the government. And when I call the smoke and mirrors approach, by that, there are a couple ways to do this. You can spend the resources and money as a dental software vendor to actually certify your software, your dental software, your workflow. The certifications and the features that you included are within your software. That's one way to go. But technically, there's kind of a little bit of a loophole in these rules and regulations, whereas you can also be a dental software vendor, not put the expense in, not put in your workflow, and actually partner up with a medical EHR that already is certified, and then go to market and say, hey, we're certified. We have our dental software. And by the way, if you use this medical EHR, then you'll also be able to get your money. Now, there's kind of a half-truth to that, because when you think about it, if you purchase a dental software and then you actually have to use a medical EHR to put in all the information in a visit that you need to be able to be eligible for the money, well, now all of a sudden, let's look at workflow. You're flipping back and forth. You're going between your dental software, you're going back to the medical software, and you're going back. So that can struggle. In fact, I had a client that was in their second year of meaningful use. They came to me to help them get their money, and they had like 5 dentists. So they were able to get a lot of money, but when they looked at what it took to take their dental software that was certified through a medical software and go back and forth in their visits between medical and dental software, they decided it wasn't worth it. It was too much of a hassle. Dentists would never use it in their workflow. So that's the one way. That's the smoke and mirrors approach that some dental vendors have used, partnering with medical EHRs. By far the best way, though, I believe, is if a dental software vendor actually puts these features into their workflow. Now all of a sudden, yes, you're eligible, but you're able to capture and use and report on all this information within the workflow of your dental software. That's very important. So remember, there are kind of 2 options you're going to run up against. Dental software vendors that have partnered with medical vendors to become certified. And again, by far, from my standpoint, the best way to go is to look at a certified dental software vendor that has that within their program, has a certification built within their program. And you can check these things out. I also want to talk a little bit about questions you should ask your vendors. So given that there's this craziness and confusion going on between vendors and certification, what are some of the questions that you should be asking your software vendor when you're looking at a certified vendor? Well, the first one is, are you certified under what's known as the 2014 testing criteria? When this program started, it started in 2011. And there are vendors that were certified under 2011 rules and regulations to become certified, which were a little bit different. Okay, and they're resting their hats on this, whereas it changed. In 2014, the rules changed. And so therefore, a vendor to keep their certification or to become a newly certified vendor had to be certified under 2014. If you are a practice and from this point forward are trying to get your money and you're using a vendor that was certified under 2011 but was not recertified under 2014, then guess what? You're not eligible. So 2014 testing criteria is the first question you might ask. Then, as I explained the confusion between medical and dental EHRs, ask them if they partner with a medical EHR or if they have that built into their workflow. And it's really important that, as I mentioned, that you do capture all these MU or meaningful use measures in your workflow. The other thing is ask them if they provide the meaningful use reports that you need to obtain your money. As I mentioned, I've worked in this program for a number of years and actually was on a committee about 4 years ago formed between vendors and practices to talk about how we can better forward meaningful use in this country. And one of the complaints that a lot of the practices had at the time was that even though a vendor allowed you to capture the meaningful use information, they didn't really provide the reports and the ability to pull the data out on the back end to actually show the government what they needed to see in order to get your meaningful use funding. So therefore, it's really important to see how vendors can get the data out of the system for you. So when you look at demonstrations, see what vendors have to offer on this. And finally, what is your long-term commitment? The reason I mention this is because this program has changed a number of times and will continue to change. In the past, there have been vendors that have actually been certified to a certain extent, and then when it's changed, maybe they don't expend the resources to change to the new rules and regulations. In fact, it's really interesting because I do a lot of contract work, and in my contracts, I always put a very robust, what I call a meaningful use guarantee. And in that, what I do is I have the vendors basically guarantee that they will continue to provide eligibility for you as a meaningful use provider. They will continue to modify their software based on the rules and regulations as they change. So this is really important because you want that guarantee. Basically, you're buying the software because it's eligible for meaningful use, and you want to know that in the future that the vendor will expend the resources to modify the software so it meets the changing criteria of the meaningful use program, so you can always be eligible for your funding, because at the end of the day, remember, it is a 6-year program, so it goes over a number of years. A big question you need to ask yourself is, do you need a consultant? As mentioned earlier, I get a lot of calls from practices that say they've been approached by consultants, quote, meaningful use consultants will help them get their money. So, do you need to have a consultant, or can you do this yourself? Well, let's go to what I call Dr. Murphy's laws of meaningful use reporting and attestation. And the first law we have is, if anything can go wrong, it will. So, personally helping practices get their money over the last years, there's been many cases where I've had to go back and forth between organizations, let's say going to state Medicaid first, going to state EHR program, not having information tie in. The volumes, the 30% volumes don't necessarily match up. I've had to go back and forth many times with state organizations to find out if a provider was eligible or not. Where we thought they were eligible, the state said they weren't eligible, then had to argue back and forth. So obviously when you deal with a number of departments and organizations, including your practice, there's a big opportunity for things to go wrong that you have to reconcile. So it's not rocket science. I mean, you could definitely do this yourself. It's just a matter of, do you have the time or the energy to do it? So that's the first thing, is there's a lot of back and forth and a lot of checking to do, reinforcing information. The second rule that I have is the only thing constant is change. So as I mentioned, this program has changed already, let's see, in the last 4 years it's changed about 3 times or so, and will continue to change. So therefore, it's really important that you keep up to date. Again, in my work I do with this, with clients and practices, I have to keep up to date. There's a new rule, there's a new proposal that by the ONC right now for making a change to meaningful use. And again, who knows, next year there'll be another one. So whether you do it or you have a consultant do it, it's really important. It's really important to make sure that the rules and regulations are kept up and that knowledge is kept up. And I guess the final thing I'll say is, make sure that if you do hire a consultant, they're going to stick with you in the long run. I've heard a lot of stories of consultants that help you get your first year money and then go away, because the second through fourth years are a lot of heavy lifting and a lot of reporting, as we talked about. So make sure that if you do work with a consultant, that they're committed to helping you in the long term. So that's really important. Finally, I want to approach the idea of, is certified technology better? So my thought is, having worked with EHRs for a number of years and working with certified EHRs for the past few years, that even if you are not eligible for the meaningful use money, it's really important to at least look at a certified EHR when you're looking at an EHR for your practice or group. The reason is because, and I've certainly been involved with a number of certifications, so I've seen firsthand at what a vendor has to do, what they have to jump through to basically become certified. And there are a number of features that are actually good for patient care and will make you a better provider in the long run and actually make it easier for you that are put into certified electronic health records. For example, the government spells out the standard for how you can do HIPAA compliant communications. There's a standard out there, and if you look at most medical EHRs, they have adhered to this. And so if you are a certified dental EHR vendor, in order to become certified, you must adhere to a certain standard for HIPAA compliance. Another thing is decision support, the ability to be able to provide treatment plans and procedures based on problems. This is very standard in medicine. This will become more popular in dentistry as it actually helps the provider to make proper decisions based on data. Okay, it's called decision support, and this is something that is put into a certified electronic health record. There's a concept called interoperability, which is the ability for your electronic health record to talk to another electronic health record. So, for example, if you're a general dentist, you do work with an oral surgeon or a periodontist and orthodontist. Technically, if they have different EHRs using interoperability, they can talk to each other. They can pass information and patient records to each other. So again, in order to become certified, you have to have this capability. You have to have advanced coding databases. We're going through a change with insurance payment, diagnosis, and a lot of other factors that are leading to getting more sophisticated coding databases that we will be using now and in the future. Again, to become certified, you have to use these coding databases in your system, or even if you don't use them now, you have to at least have the connection to these databases. We have to have patient access to information. As you know, we're in an online world, and patients need to get their information. In fact, under HIPAA, a patient needs to be able to access their information electronically. Or other factors, you want to be able to do things like get records and other information over the internet for a patient. These are things that are required by the government to become certified. And finally, I just want to say that in general, after all is said and done, that a certified electronic health record is what I call future enabled. Okay, it basically has the hooks in it. If it doesn't have the feature now, it has the ability to add what features are coming down the pike. So again, I really want to emphasize that if you're looking at an electronic health record system, and even if you are not eligible for the federal money, the meaningful use money per se, that you might look at certified electronic health record systems, because I think in the long run, they will be better than just any old electronic health record system. So to close this, I want to encourage you to go to a new section in Dental Software Advisor. This has become so confusing that our group at dentalsoftwareadvisor.com thought it was really important to start building a meaningful use section. So in order to find out what's new, who's doing what the rules and regulations are, I encourage you to visit our new meaningful use section. So that can give you some information and a heads up. So I thank you for taking your time to listen to this webinar, and I hope it's at least informed you and given you some information so you don't leave money on the table regarding the federal EHR incentive and meaningful use program.